Navigating the road to success, from fee-for-service to fee-for-value. Coordinating patient-centered care, enhancing quality, not quantity, reducing costs and managing risk is the name of the game today. What is bundling? Bundling is a single payment for an array of clinical services. The Bundled Payments for Care Improvement Initiative is comprised of 4 broadly defined models of care, which link payments for multiple services beneficiaries receive during an episode of care. Under the initiative, organizations enter into payment agreements that include financial and performance accountability for episodes of care. These pilot models are designed to lead to higher quality and more coordinated care across the spectrum of providers at a reduced cost to Medicare. The 48 episodic bundles defined by CMS are currently being tested today to reimburse providers for performance-based outcomes as an innovative strategy to pay for healthcare services, an approach that improves the quality of patient care at a lower cost. But how exactly do departmental payments work? First, bundles define all the healthcare services received during the patient's entire episode of care, including acute and post-acute services. For example, CMS makes a single payment to hospitals for the care provided based on the inpatient MSDRGs and is distributed through the service providers from Medicare for their service within the bundled episode of care. Policymakers, providers, and payers are now exploring bundled payments that cross provider solos and include a variety of services from different providers. For instance, a hospital and physician services or all services post-hospital discharge will be bundled for a specified amount of time, which will include hospitals, skilled nursing facilities, home healthcare services, assisted living facilities, physicians, durable medical equipment, hospital readmissions. The episode typically begins with a hospitalization and continues after discharge for 30, 60, up to 90 days set of care, in which the bundle includes payments for all services received by the patient during the 90-day period, along with rehospitalization that may occur, including hospital stays and physician services, as well as diagnostic tests and nursing home and home health care in a bundled payment program, are comprised of a set target price for all the services based on historical cost for these services minus the discount. This discount is typically 2 or 3%. A healthcare bundle estimates the total cost of all of the services a patient would receive per episode over a set time period for certain problems, like a knee replacement or heart surgery. For example, a payer such as Medicare could calculate that a hypothetical 30-day bundle for a knee replacement surgery costs $10,000. The payer reduces the total cost of the episode by 2 to 3% and hands the bundle over to the provider. In the knee surgery example, that becomes $10,000 minus 2%, so $9,800. The provider is then responsible for all costs of treatment, whether or not it exceeds the amount of money they were originally given. This encourages the provider, collaborating with the entire care team, to help the patient avoid preventable complications like a hospital readmission by better managing a patient's care. If the provider keeps costs low, they can keep the margin on the bundle. So, in our example, if the provider was able to meet the quality benchmarks and the total cost of the 30-day episode was $9,000, they get to keep the extra $800. All providers in a retrospective program continue to submit bills to Medicare the same way they currently do, and Medicare in turn directly pays the providers using established payment rates and policies. Meanwhile, federal contractors track those payments on an episode-by-episode basis. If the payments for a patient's episode of care are higher than the target price, then the authority must pay the entire difference to CMS. Under this example, Medicare is guaranteed to save 2 to 3% benefits by creating a new way to manage and control healthcare spending. Conversely, the awardees are at risk for spending more than the target price, but are able to retain or share savings from spending that is below the target price. In the world of bundled payments, most experts believe that you seldom improve quality by cutting costs, but you can often cut costs by improving the quality. New frontier with added responsibility and expectations. In Model 3, the episode of care is triggered by an acute care hospital stay and begins at initiation of post-acute care services with a participating skilled nursing facility, inpatient rehabilitation facility, long-term care hospital or home health agency. The post-acute care services included in the episode must begin within 30 days of discharge from the inpatient stay and end 30, 60, or 90 days after the initiation of the episode. Research has shown that bundled payments can align incentives for providers, hospitals, post-acute care providers, doctors, and other practitioners to partner closely across all specialties and settings that a patient may encounter to improve the patient's experience of care during a hospital stay in an acute care hospital and during post-discharge recovery. Bundled Payments Care Improvement Initiative. Is it inevitable? CMS made a bold announcement in January 2015. It plans to ramp up its timeline for transitioning Medicare from fee-for-service payments to value-based reimbursement. For the first time, CMS is being incredibly specific about its timeline and methodology. It plans to take the following 2 actions. 30% of payments will be tied to alternative payment accountable care organizations or bundled payment arrangements by the end of 2016. Payments related to these models will increase to 50% by the end of 2018. 85% of all traditional Medicare payments will be tied to quality or value by 2016, and 90% by 2018 through programs such as hospital value-based purchasing and hospital readmission reduction. The looming question each of you need to ask yourselves as healthcare leaders is, do we have the right partner alignment in place who have clinical programs focused on reducing readmission, improving patient-centered care to drive overall satisfaction and beneficiary experience? Well, look no further, as Assure Home Healthcare at-Home Core Solutions' triple-aim patient care approach of education, empowerment, and engagement is initiated on an evidence-based protocols and intervention disease management tool to guide the patient towards positive outcomes with the utilization of motivational and interviewing techniques, and teach-back methods creating involvement of the patient in their own recovery process, leading to self-management best practices. Our at-home core solution suite of programs consists of the 5 pillars of enhanced care, triggered by our transitional care model 48 to 72 hours prior to discharge, to the community where the TCN evaluates medical, functional, and environmental needs to prepare the beneficiary and their family members for a smooth transition home. Part of our BPCI redesign, the transitional care nurse hands off the TCN plan of care at discharge to the patient navigator, who will be the liaison for the entire episode of care, managing communication between all disciplines for the patient and their family members, ensuring compliance of medication adherence. Follow-up appointments with PCP are secured and maintains contact with patient and family for a 90-day episode, utilizing a rehospitalization risk assessment to determine when intervention should be incorporated into the care plan. Some questions to ask when considering engagement with a partner in a bundled payment program. Number 1. Do you have the data necessary to evaluate current practice patterns to identify possible areas of improvement? Number 2. Do you have an effective process in place with solid clinical leadership to quickly and successfully implement changes in care processes? Number 3. Have you already identified what those changes need to be? Number 4. Do you have the right partnerships in place with other providers to manage transitions and effectively coordinate care? To learn more about Assure Home Healthcare's BPCI strategy and the benefits of partnering together to provide the best-in-class patient care experience, contact our office to get started today.